One of the most common things I hear from patients is, I'm losing hair, what treatment should I do? And my answer is usually this. Hair loss is not a single diagnosis, and that is often why treatments do not work the way people expect them to. I'm Dr. Preethi Jeyabal, Director of Regenerative Aesthetics, Hair Restoration and Dry Eye Services at Eagle Aesthetics and Surgery. Today, I want to talk about why understanding the cause of hair loss is far more important than choosing a treatment, and why a one-size-fits-all approach often leads to frustration. Before we begin, be sure to subscribe to our channel to stay updated with us on all things aesthetics, hair restoration, eye health, and plastic surgery. Hair loss can be emotionally distressing, and it often feels urgent. Many patients notice more hair on their pillow, in the shower, or on the floor, and naturally want a quick solution. Won't you? What makes hair loss especially confusing is that it can look very similar on the surface, even though the underlying causes are completely different. Two people may both be shedding hair, but the reason and therefore the treatment may not be the same. This is where many people get stuck. They try a treatment that worked for someone else, or they start multiple products at once without knowing what they are actually treating. Not all hair loss behaves the same way. Some types of hair loss are related to the hair growth cycle and cause increased shedding. Others involve gradual thinning and miniaturization of hair follicles. Some are triggered by stress, illness, hormonal changes, or nutritional factors, while others are more strongly influenced by genetics. Because these patterns behave differently, they also respond differently to the treatments. What helps one type of hair loss may have little effect or even worsen anxiety in another. This is why diagnosing the pattern and cause of hair loss is the foundation of effective management. When patients say a hair loss treatment has failed, it is often not because the treatment itself is ineffective. Sometimes the treatment was not suited to the underlying diagnosis. In other cases, the timeline did not match expectations. Hair loss is slow and meaningful change takes time. In the early stages of treatment, increased shedding can even occur before improvement is seen, which can be alarming if patients are not prepared for it. Without proper explanation, this phase is often mistaken for treatment failure. Assessment and diagnosis is important. A proper hair loss assessment looks at more than just the scalp. We consider the pattern of hair loss, the duration, recent life events, medical history, lifestyle factors, and sometimes laboratory findings. This allows us to distinguish between different causes and decide whether the focus should be on stabilizing shedding, stimulating regrowth, supporting scalp health, or addressing other contributing factors. Once the diagnosis is clear, treatment becomes more targeted and expectations become more realistic. One of the most important parts of hair loss management is setting appropriate expectations. Hair does not regrow overnight. Improvements are usually measured in months, not weeks. Stabilizing hair loss is often the first goal before regrowth becomes visible. Once you understand this, you can feel more at ease with the process. With the long timeline in mind, you can also feel more confident to stay consistent with the treatment. Hair loss is rarely something that can be fixed with a single intervention. For many people, it requires a long-term, individualized plan that may evolve over time. Treatments may be adjusted as the scalp responds, life circumstances change, or new concerns arise. The aim is not just to chase regrowth, but to support healthier hair over the long term in a way that fits each individual's needs. So hair loss is not a single diagnosis, and successful management starts with understanding what is actually happening beneath the surface. Choosing the right approach begins with a proper assessment by an experienced doctor, realistic expectations, and a personalized plan. If you are experiencing hair loss and would like a thorough evaluation, speak to us at Eagle Aesthetics and Surgery to arrange a consultation, and let us help you navigate hair loss with confidence.